Have you ever felt completely fine one day, only to wake up the next morning with a strange numbness in your hand or a wave of dizziness you couldn't explain? A patient of mine once told me she assumed it was just age catching up, so she brushed it off and went on with her day. And I want you to imagine this for a moment. You wake up, stretch, put your feet on the floor, and something feels slightly off, almost like your body is whispering a warning you're not sure how to interpret. These moments matter more than most people realize, especially if you're living with diabetes. Many seniors believe diabetes only affects blood sugar levels, not the brain, and certainly not the delicate blood vessels that keep the brain alive. But the truth is that the risk of stroke is 2 to 4 times higher in people with diabetes. What makes this so concerning is that the connection is rarely explained clearly. Symptoms like dizziness, blurred vision, or morning weakness get dismissed as simple aging when they often deserve far more attention. The real issue is that high blood sugar quietly damages blood vessels for years before a stroke ever happens. Diabetes makes arteries stiffer and blood thicker, and it disrupts the brain's oxygen supply in ways most people never notice until something goes terribly wrong. These changes make strokes not only more likely, but also more severe when they occur. This truth is rarely discussed because many medical visits focus on glucose numbers, A1C readings, diet reminders, and medication adjustments. There's rarely enough time to explain how diabetes affects the brain's blood vessels and why even mild symptoms can signal a deeper problem. I've seen patients who felt perfectly fine until one small, subtle sign was followed by a life-changing stroke. I like to describe it simply. Sugar behaves like tiny crystals, scratching and irritating the inner walls of your arteries day after day. Over time, those scratches turn into damage, and that damage turns into risk. In the next section, we'll explore exactly how diabetes harms the brain's blood vessels, why strokes happen more often in diabetics, the early warning signs you should never ignore, and the simple daily habits that can dramatically protect your health. If you haven't subscribed yet, make sure you do, because this next part might change the way you care for your body forever. How diabetes actually raises stroke risk. When we talk about diabetes, most people immediately think about glucose numbers, A1C, diet changes, and maybe nerve pain or vision problems. But very few imagine what is happening inside their blood vessels every single day, especially the delicate arteries that feed the brain. Diabetes changes those arteries in slow, silent ways that most seniors never feel until something serious happens. And that is exactly why strokes are so much more common in people with diabetes. To understand this, imagine the inside of your blood vessels as a smooth, soft surface, almost like the lining of a new garden hose. This lining is called the endothelium. It helps your vessels stay flexible, helps blood flow smoothly, and protects your brain from sudden pressure changes. Now imagine tiny sugar crystals moving through your bloodstream day after day. When glucose levels stay high, those crystals irritate and scratch that soft lining. Over time, the surface becomes rough, then inflamed, then damaged. Once that happens, the artery can no longer protect itself. Blood starts to move more slowly, and tiny clots begin forming in places they don't belong. That slow damage is what raises stroke risk so dramatically. High glucose thickens the blood, almost like syrup compared to water. Thicker blood moves slower. Slower blood is far more likely to form clots, and those clots can break loose and travel straight to the brain. Suddenly, a vessel gets blocked, oxygen stops flowing, and brain cells begin to die within minutes. That is the very definition of an ischemic stroke, the most common type in diabetics. But the story doesn't stop with blood thickness. Diabetes also increases inflammation throughout the body. Inflammation acts like rust. It makes the arteries stiff and fragile. And when arteries lose their softness, they become far more vulnerable to pressure spikes. A small jump in blood pressure, the kind that might happen when you stand up quickly or walk uphill, can be enough to trigger a stroke in someone whose vessels are already weakened. Another hidden problem is oxidized LDL. You've probably heard people talk about good cholesterol and bad cholesterol. But the truly dangerous kind of LDL is the oxidized form, and diabetics produce more of it. Oxidized LDL sticks to damaged artery walls like glue. It builds plaque, narrows the vessel, and cuts off blood flow. When a vessel is narrowed, even a tiny clot can cause a major stroke. And if the plaque suddenly breaks, the result can be catastrophic. Let me share a simple example from my own experience. One of my patients was a woman in her late 60s who always kept her glucose under control according to her blood tests. But she had lived with diabetes for more than 20 years, and over time, her arteries had quietly stiffened. She walked into my office one afternoon complaining that she felt a little more tired than usual, and sometimes had to stop halfway through sentences to gather her thoughts. She had no pain, no dizziness, no big warning signs, but an ultrasound later revealed severe artery stiffness, the kind that often appears right before a stroke. To her, she was doing everything right. Inside her body, the story was much different. Diabetes also disrupts one more thing, something most people never hear about. It weakens the brain's ability to regulate blood flow. Healthy vessels can expand or tighten depending on the brain's needs. Diabetic vessels lose that flexibility. They become stiff and slow to respond. When the brain requires more oxygen or when pressure changes suddenly, those vessels simply cannot adapt. That is why diabetics are so vulnerable in moments of quick movement, dehydration, or stress. This is not meant to scare you. It is meant to give you clarity. When you understand what is happening inside your body, you gain power. You are no longer a passive passenger. You are someone who can make decisions that protect your brain and your future. The types of strokes. Most common in diabetics. When we talk about diabetes and stroke, many people imagine just one type of stroke. But the truth is that diabetes creates several different pathways that can lead to a stroke, and each one looks a little different inside the body. Understanding these forms brings clarity, comfort, and a sense of control. Knowledge doesn't create fear, it creates safety. The most common type of stroke in people with diabetes is an ischemic stroke. This happens when a blood vessel becomes blocked and oxygen can no longer reach a part of the brain. It doesn't always start with dramatic symptoms. In many diabetics, it begins with small clots forming in damaged arteries, especially those narrowed by plaque. When the blood thickens from high glucose or dehydration, these tiny clots can easily become stuck in a small vessel. Within seconds, that part of the brain becomes starved of oxygen. If you've ever felt a moment of sudden confusion, a brief darkening of one eye, or numbness in your fingertips that faded quickly, that can sometimes be a fleeting warning that the brain didn't get enough blood. Then there are lacunar strokes. These are small strokes deep inside the brain's tiny vessels, the ones most affected by long-term high blood sugar. These vessels are extremely delicate. Years of diabetes can make them shrink, stiffen, and eventually clog. Lacunar strokes often go unnoticed at first. A senior might simply say they feel slower, more tired, or mentally foggy. Over time, these tiny strokes can affect memory, balance, and the ability to think clearly. Many families mistake the symptoms for normal aging, when in fact, they are early signals of vessel damage. The third type is less common, but far more dangerous. Hemorrhagic strokes occur when a weakened blood vessel actually ruptures and bleeds into the brain. In diabetics, vessels lose elasticity and become fragile. A sudden rise in blood pressure, even something as simple as standing up too quickly or experiencing a moment of intense stress, can be enough to cause a rupture in someone whose arteries are already compromised. When this happens, symptoms appear fast and hard: a severe headache, sudden weakness, trouble speaking, or collapse. These events are medical emergencies. I remember a gentleman in his 70s who came to see me after several weeks of feeling off in the mornings. He mentioned blurred vision that lasted only seconds and assumed it was a side effect of his medication. His wife noticed he was moving slower and seemed unsure of his steps, but he brushed it off. Within days, he experienced a sudden drop in coordination and slurred his words while trying to pour his morning coffee. Tests later showed he had suffered multiple small strokes over the years, each one so subtle he didn't realize what was happening. Those tiny events were warnings, signals from his brain that his vessels were struggling under the combined pressure of high glucose and inflammation. Stories like his remind us that diabetes doesn't just increase stroke risk, it changes the way strokes appear. They become quieter, subtler, and easier to overlook. That is why paying attention to the body's whispers is just as important as recognizing its alarms. When we know what kinds of strokes are most common and why they happen, the fear begins to fade. You start to recognize what your body is trying to tell you, and you gain the power to respond before something serious occurs. Hidden factors that make diabetes even more dangerous. As we move deeper into understanding diabetes and stroke, I want to talk about something that often surprises people. The biggest dangers are not always the ones you see clearly on a medical chart. They're the quiet, invisible factors that slowly build pressure inside the body, creating the perfect conditions for a stroke long before any dramatic symptoms appear. These hidden risks are the reason so many seniors feel blindsided when something happens, even when they thought their diabetes was under control. One of the strongest and most underestimated dangers is high blood pressure combined with diabetes. These two conditions feed into each other in a way that places tremendous strain on the arteries. High glucose makes blood vessels stiff, and high blood pressure pushes against those stiffened walls with more force than they can handle. It's like pressing on old, cracked plumbing. The more pressure you apply, the more likely it is to clog or burst. I've seen seniors who maintained perfect glucose numbers for months, but still face stroke scares simply because their blood pressure wasn't being monitored closely enough. Another hidden factor many people overlook is triglycerides. Most seniors hear a lot about LDL and HDL, but triglycerides quietly contribute to plaque buildup and inflammation. When triglycerides rise, especially in diabetics, the blood becomes thicker and more sluggish. That slow-moving blood has a harder time navigating narrow arteries, giving clots more opportunities to form. People assume sugary treats only affect glucose, but in reality, they fuel triglyceride production too, adding another layer of risk. Sleep apnea is another silent danger. Many seniors snore or wake up feeling unrefreshed without realizing that their oxygen levels drop repeatedly throughout the night. When oxygen dips, the brain panics. Blood pressure spikes, heart rhythm becomes stressed, and vessels are pushed to their limits. For diabetics, whose vessels are already weakened, these nightly stress cycles can be enough to trigger a stroke. I've had patients who didn't take their morning dizziness seriously until a sleep study revealed episodes of oxygen deprivation happening every night. Dehydration is another subtle enemy. Even mild dehydration thickens the blood, making it harder for the heart to pump and easier for clots to form. Seniors often drink less water without noticing, especially those who take diuretics or worry about nighttime bathroom trips. But when blood is thicker and vessels are inflamed from long-term glucose exposure, the risk multiplies quickly. Stress might be the quietest of all. When stress hormones rise, glucose rises with them. Blood pressure follows close behind. A single night of worry, a few days of tension, or a stressful week with family can create real physical consequences for someone managing diabetes. I've seen seniors go from stable numbers to alarming spikes after a stressful period, not because they changed their eating habits, but because their body was reacting to emotional overload. Finally, inactivity becomes a hidden catalyst. The less we move, the slower blood flows. The slower it flows, the easier it is for plaque to settle and clots to form. Winters, long TV nights, and days spent indoors all contribute to sluggish circulation. Many seniors don't realize how much movement protects their arteries until they experience symptoms of poor blood flow and wonder where it came from. Hidden dangers like these explain why diabetics are at much higher risk for stroke, even when they feel like they're managing their condition well. But understanding them brings power. Once you know what's working against you, you can start making choices that work in your favor. Early warning signs of stroke in diabetics. Now that we've uncovered the hidden dangers that make diabetes so closely tied to stroke, I want to take you somewhere even more important. I want to walk you through the early warning signs that so many seniors brush aside. And I say this with genuine care. These signs are often small, quiet, and easy to misunderstand, especially for someone who has lived with diabetes for years and is used to minor fluctuations in how their body feels. One of the earliest signs is temporary blurry vision. Many diabetics assume blurred vision is simply a sugar swing or a tired eye, but the truth is that sudden changes in vision can signal poor blood flow to the brain. When the tiny vessels around the eyes become stressed, the brain receives the same message. It's the body's way of whispering that something isn't right. Numbness is another sign that often gets dismissed. A tingling hand, a numb fingertip, or a heavy sensation along one side of the face may seem harmless, especially for seniors who already deal with neuropathy. But neuropathy tends to be gradual and predictable, while stroke-related numbness appears out of nowhere. It may last a few minutes or linger just long enough for you to notice before fading away. That brief episode is not something to overlook. Sudden difficulty finding words is another warning many seniors misinterpret. A diabetic might think their sugar is low or that they're simply tired, but the brain uses immense energy to form language. When blood flow is interrupted, even for seconds, the ability to find the right words can falter. These episodes may be subtle. The right word feels stuck. A simple sentence is harder to form. You may laugh it off, but your brain isn't laughing. It's signaling distress. Loss of coordination is a red flag that diabetics frequently chalk up to fatigue. Maybe your foot doesn't land exactly where you expected. Maybe you feel wobbly when you get out of a chair or take your first steps in the morning. That unfamiliar unsteadiness is a message. When the brain struggles to receive oxygen, balance is one of the first abilities to suffer. Morning headaches can be particularly concerning. Many diabetics believe a headache is caused by stress or dehydration, but a sudden, sharp, or persistent morning headache often points to overnight blood pressure spikes or reduced oxygen flow. These conditions make the brain far more vulnerable to stroke, especially for someone whose blood vessels are already weakened by high glucose. Then there's the feeling that something is just off. Many seniors describe it as a fogginess or a sudden inability to concentrate. Others feel unusually tired or queasy without explanation. Diabetes can certainly cause fluctuations in energy, but when this fog comes on quickly and feels different from your usual patterns, it's worth paying attention. I want you to hear this clearly. Diabetics often misinterpret these early signs as low sugar or simple fatigue. But these are not inconveniences. They are signals that the brain is struggling. Signals that deserve immediate respect. And signals that, when recognized early, can be life-saving. Understanding these warning signs doesn't create fear. It creates awareness. And awareness is one of the strongest tools you have to protect yourself. Dangerous myths that mislead seniors. As we continue this conversation, I want to address something that quietly places so many seniors at risk: the myths surrounding diabetes and stroke. These misunderstandings don't come from carelessness. They come from decades of hearing simplified explanations, rushed doctor visits, and a lifetime of trying to make sense of a complicated condition with very little guidance. But these myths are powerful, and when they take root, they can shape the way people respond to symptoms, manage their health, and interpret warning signs. One of the most dangerous beliefs I hear is that if sugar levels are controlled today, the risk of stroke must be low. Many seniors look at a good A1C result and assume the body is perfectly safe. What they don't realize is that artery damage doesn't appear overnight. It accumulates over years, even decades. A person can have excellent numbers now, but still carry years of silent damage in their blood vessels. When I explain this to patients, I often see a mix of surprise and relief, because it finally makes sense to them why good numbers alone never tell the whole story. Another harmful myth is the idea that feeling fine means the arteries must be fine. I wish that were true. But the most serious artery damage is almost always silent. There are no nerves inside your blood vessels to warn you that plaque is building or that inflammation is rising. I've met seniors who walked miles every day, felt energetic, and still faced stroke scares because the inner walls of their arteries had been silently narrowing for years. Wellness on the outside doesn't always reflect wellness on the inside. There's also the belief that only people who are overweight need to worry about diabetes-related strokes. This misconception has caused too many people to ignore early symptoms because they didn't fit the picture of someone at risk. Thin people can develop diabetes. Thin people can have dangerously high triglycerides. Thin people can accumulate artery plaque. Diabetes doesn't discriminate based on body size, and stroke risk doesn't either. Another myth that often reassures people falsely is the idea that medication alone will fix everything. Diabetes medication is powerful and absolutely necessary for many. But it cannot undo stiffened arteries, and it cannot reverse years of inflammation by itself. Medication is a tool, not a cure. I've watched seniors take their pills faithfully, yet continue the same habits that quietly raise stroke risk day after day. They trusted the medicine to carry the entire burden, not realizing the body needed partnership, not just prescriptions. And finally, many seniors believe the A1C test is the only number that matters. While A1C gives an average picture of blood sugar over time, it doesn't show glucose spikes, inflammation, triglycerides, cholesterol oxidation, or blood vessel stiffness. It's one piece of the puzzle, not the full picture. These myths don't exist because people are careless. They exist because the truth is rarely explained gently and clearly. And correcting them isn't about creating fear. It's about giving you a brighter, more accurate understanding of your body so you can protect yourself with confidence. Daily habits that dramatically lower stroke risk. Now that we've uncovered the hidden dangers, the warning signs, and the myths that often mislead seniors, I want to shift the energy of our conversation towards something far more hopeful. Because no matter how long you've lived with diabetes, and no matter how much damage may have begun quietly inside your blood vessels, your daily habits still have the power to change your future. Stroke risk is not fixed. It is not a sentence. It is a direction, and you can turn that direction around with choices that are gentler, simpler, and more manageable than most people ever realize. One of the most powerful habits is as simple as drinking water early in the day. After a full night of sleep, your body wakes up slightly dehydrated. And for diabetics, this means the blood becomes thicker and moves more slowly. When you drink water first thing in the morning, you help your heart pump more easily and reduce the chance of clot formation. It's a quiet gift you give your circulation before your day even begins. Movement is another essential pillar of protection. I'm not talking about intense exercise or long workouts. I'm talking about standing up, stretching, or taking a few steps every hour or so. When you move your body, even lightly, you wake up your circulation. Blood that sits still tends to clot more easily, especially in diabetics. So giving your vessels little reminders to stay active can make a meaningful difference. I once had a patient who set a timer to stand up every 90 minutes. After a few weeks, her blood pressure steadied and her energy improved, all from something so gentle and achievable. Sleep is another tool that many people underestimate. Poor sleep raises blood sugar overnight, elevates cortisol, and stresses the heart. When you sleep well, your body enters a restorative state that reduces inflammation and protects the brain. Seniors often tell me they struggle with sleep because of worry, discomfort, or nighttime bathroom trips, and I remind them that improving sleep doesn't require perfection. Even a small improvement in consistency can lighten the load on the heart and stabilize morning glucose levels. Reducing sugary drinks and processed carbs might be one of the most transformative steps you can take. These foods push glucose higher and faster than the body can handle, and over time, they feed triglycerides, inflammation, and vessel damage. When you replace them with whole foods, leafy greens, berries, healthy fats, and omega-3 rich meals, you help your blood vessels stay flexible and calm. I once worked with a 72-year-old woman who stopped drinking soda at night and added a 15-minute walk after dinner. Her cholesterol dropped, her blood pressure improved, and she told me she finally felt lighter, not just in her body, but in her mind. Checking your blood pressure weekly is another form of self-protection. Diabetes and high blood pressure often travel together, and many seniors don't notice the rise because it creeps in quietly. A small home monitor can offer powerful insight into your body's patterns. When numbers climb suddenly, your body is asking for attention, not fear. Managing stress may be one of the gentlest but strongest habits of all. A minute of slow breathing, a short moment of calm reflection, or a few steps outside to feel the sunlight can lower cortisol and smooth out blood pressure. It isn't about avoiding stress completely. It's about giving your body pockets of peace during the day so it doesn't carry everything alone. Even the timing of your meals matters. Eating at consistent times keeps blood sugar steady and prevents the dramatic swings that strain your arteries. It also supports your metabolism and helps you maintain muscle mass, which is crucial for balance and blood sugar control. These habits might sound simple, but they are far from small. They work together like a protective circle around your brain and heart. They help your blood flow more freely, your vessels become more resilient, and your energy grows steadier. Most importantly, they place your health back into your hands, one small action at a time. What seniors should discuss with their doctor. As we reach the final part of this deep and important conversation, I want to talk about something many seniors hesitate to do. Asking questions during a doctor's visit can feel intimidating. Maybe you don't want to take up too much time, or you worry the questions might sound unnecessary, or you've been told for years to simply trust the numbers. But when you're living with diabetes, your voice is not just welcome, it is essential. The questions you ask can shape the care you receive, reveal risks no one has mentioned, and help prevent the very strokes we are working so hard to avoid. One of the most powerful questions to ask is about your blood vessels. It might feel unusual at first, because so many appointments focus on glucose, medications, and diet. But your arteries tell the real story of your long-term stroke risk. A simple, calm question like, "How are my blood vessels doing?" opens a doorway to a deeper conversation. It invites your doctor to think beyond lab values and consider the health of your vessel walls, the flexibility of your arteries, and the level of inflammation that may be quietly affecting your brain. Another meaningful question is whether you show early signs of artery stiffness. Arteries naturally lose flexibility with age, but diabetes accelerates that process. When vessels become stiff, they struggle to handle changes in blood pressure, especially in the morning. Understanding whether stiffness is developing gives you the chance to make choices that slow it down. It's also wise to ask about triglycerides. Many seniors focus only on LDL and HDL, but triglycerides play an enormous role in clot formation and plaque buildup. A simple conversation about whether your triglycerides are too high can uncover risks that might never appear in a routine explanation of your labs. You can also ask whether you might need additional testing beyond A1C. A1C is helpful, but it doesn't show glucose spikes, oxidative damage, inflammation, or the actual condition of your arteries. Sometimes a more detailed test can reveal what basic labs cannot. Asking whether your medications could affect stroke risk is another vital step. Some prescriptions for blood pressure, pain, or even sleep can interact with diabetes in unexpected ways. Understanding how your medications work together allows you to stay ahead of potential problems instead of reacting to them later. And finally, it helps to ask whether any early signs of neuropathy or balance changes might be affecting your safety. Even mild numbness or slight shifts in balance increase the risk of falls, which can trigger sudden changes in blood pressure and place tremendous stress on weakened vessels. These questions are not challenges. They are acts of self-respect. They show that you are an active participant in your care, not a silent passenger. I've seen patients transform their health simply because they felt empowered to speak up, and because their doctors gained a fuller understanding of what their bodies were trying to say. When you ask these questions, you aren't burdening your doctor. You're inviting them into a partnership, and that partnership might be one of the most powerful protections you have against stroke. As we come to the end of this journey together, I want to leave you with something deeper than facts or numbers. Your body has carried you through an entire lifetime. It has moved you through joy, stress, growth, loss, laughter, and everything in between. Even now, it wakes up each morning trying its best to keep you safe. That alone makes your body worthy of care, patience, and gratitude. Understanding diabetes does not mean living in fear. It means giving yourself the gift of clarity. When you understand how diabetes affects your blood vessels and why the brain becomes more vulnerable, you gain power. You gain choices. You gain confidence. Stroke is not something that sneaks up on a hopeless body. It is something that can be prevented and softened by the way you live, the way you listen to your body, and the way you take small steps each day. Every gentle habit you choose matters. Drinking water when you wake up, moving your body a little more often, giving yourself calmer mornings, eating meals that nourish your heart and brain, resting when your body asks for it, and keeping your stress lighter. These are not small acts. These are messages of love you send to your future self, and they build strength where fear once lived. You are not walking this path alone. Senior Health Daily is here to guide you, to help you understand your body with honesty and compassion, and to remind you that your health is worth fighting for. I want you to know how proud I am of every step you take toward caring for yourself. Change happens quietly, then beautifully. Thank you for spending this time with me. I'm grateful for you, and I hope you stay close, stay curious, and stay committed to your health. We're in this together, and your story is far from over.